All right, today we're doing a deep dive into getting those really essential health answers and getting them fast.
We are, and we're focusing specifically on pregnancy blood tests.
Exactly. And our whole mission here is to unpack a guide you shared with us from Blood Test UK.
A fantastic resource.
It is, and it's great because it focuses specifically on the services right there in Poole, so it's super local.
And that local piece is so important. So just to start, what is this test?
Well, in the simplest terms, it's a quick blood draw.
Okay.
And it looks for a special hormone called HCG. That's human chorionic gonadotropin.
The pregnancy hormone.
The pregnancy hormone, you got it.
Yeah.
It's the body's first real signal that a pregnancy has started.
Okay, so let's get right into it then. I mean, we all know about the home kits, the pee on a stick test. They're simple, they're fast.
Of course. They're very common.
So why would someone go through the trouble of a blood test? You know, scheduling an appointment in Poole, going into a clinic. What's the real benefit?
It really all comes down to one word: precision.
Precision, yeah. A home test gives you an answer, sure. But a blood test is it's so much more sensitive, it's more reliable.
And what does that actually mean for someone waiting for an answer?
Well, two massive benefits. First, early detection. A blood test can confirm a pregnancy way earlier than other methods, sometimes even before a missed period.
Wow, so that offers a lot of peace of mind, and much sooner.
A huge amount of peace of mind.
Yeah.
And second, it allows doctors to properly monitor the health of the pregnancy right from the very beginning.
Okay, and on that point, the guide from Blood Test UK mentions two different kinds of blood tests.
That's right. You have the qualitative test first.
Which is just a simple yes or no, right? Is the hormone there or not?
Exactly. But then you have the quantitative test.
And that one measures the actual amount of the hormone, gives you a number.
Precisely. And that number is so important.
But I have to ask, if you already have a yes, isn't getting a specific number a bit like overkill?
You'd think so, but no, not at all. For the doctors, that number is everything.
So what does that number tell them that a simple yes can't?
It's all about the trend. The doctors don't just look at that number once. They track it over time.
To see if it's going up?
And, more importantly, how fast it's going up. It's often called the doubling time.
The doubling time. Okay, now this sounds like where the real value is.
Because a healthy early pregnancy has a very predictable pattern. The HCG level should roughly double every 48 to 72 hours.
And if it doesn't, what does that signal?
Well, if it's not rising at that expected rate, it could be an early warning sign. It lets doctors investigate potential risks, like an ectopic pregnancy, for example.
So having that precise data right away from a local clinic there in Poole means they can act immediately.
Immediately. It allows the healthcare plan to be tailored right from the start, which is it's huge for getting the best possible outcome for both the mother and the baby.
So that local access is really about the speed to proactive care.
Absolutely. And as the guide points out, preparation is simple. You just, bring your ID, maybe an NHS card. Accessibility in the UK is quite strong.
Through the NHS or through private options?
Yes, and the private clinics mentioned by Blood Test UK follow very strict UK medical guidelines, so you can trust the quality of care.
So if we kind of wrap this all up, the main takeaway is that these blood tests are about so much more than just a yes.
They really are. They're about getting fast, reliable data. It's for peace of mind, of course, but it's also for proactive health management.
Using that specific HCG number to get the absolute healthiest start possible.
You got it. But this brings up a really interesting thought about where all this blood-based technology is headed.
Oh.
The guide actually mentions another newer test. It's called NIPT.
NIPT, what's that?
It stands for non-invasive prenatal testing. It's also a blood test from the mother, but instead of just looking for a hormone, it can actually analyze fragments of the baby's DNA.
Wow, directly from the mother's blood.
Directly from her blood. It's incredible. It just shows how science is constantly finding these safer, non-invasive ways to check on health with ever-increasing precision.
That is definitely something to think about. And if you are looking for more details, maybe on scheduling or the costs in the Poole area,
then we really encourage you to review the full guide from Blood Test UK that we use for our deep dive today. It's all in there.